Hey guys, in this video I'll be covering the side effects that you can see with the prescription drug Modafinil. I'll go over what it does in the body, will help you understand why you see certain side effects. I'll cover the most common side effects, and I'll also show you some groups of people that want to be very careful taking it. So basically when you take Modafinil, what we see is that you can see an increase in dopamine in the brain, and this is for a lot of people considered a good thing, but it can cause some other side effects as well. I do want to point out, people ask the question, well, Modafinil, it is a stimulant, you know, it's so is amphetamine, speed, those sorts of things. It does have a lower affinity for these dopamine receptors in the brain, so keep that in mind. It has been shown to increase mental alertness in study. It's also been shown to affect GABA neurotransmitters, which is going to become important at the end here where I talk about some of the warnings. So what about side effects? What are you going to see if you and your doctor decide to go in this route? Well, first of all, the most common one is going to be a headache. Again, dopamine in the brain, it kind of plays into that. Adults, we can see it in 34%, up to 34% of users. Interestingly, kids come into play in some of these side effects. Kids, 20% can see it. The next two most common side effects only occurred in kids in the study. Number one was a decrease in appetite in 16% of those kids. There was also abdominal pain reported in 12%. Now we move on to nausea. This was across the board, not, you know, pulling out kids versus adults. This is just as a group. We see 11% of people. And then we have nervousness and rhinitis. Rhinitis is basically like seasonal allergies or a cold, but 7% of those folks. Now there are some warnings that you need to know about. Okay, all drugs can potentially cause rashes, right? But with Modafinil, you have to be very careful because the rashes can be serious. If you see any sign of a rash, you do need to stop. You need to call your doctor. And this is why Modafinil was not approved for ADHD treatment in kids, because of some of these severe rashes that we saw. So please keep that in mind. Next, people that have Tourette's syndrome, this may actually make it worse. That's something you'll want to know about. And going back to that GABA thing that I mentioned and how it works in your body, I mentioned it affected GABA neurotransmission. Well, that plays a role in seizures. So if you have a seizure disorder, Modafinil could potentially make that situation worse, make you prone to seizures again. Not for sure, but just keep an eye on it, talk to your doctor. We do want to watch it in people with psychosis, depression, or mania, like you can see in bipolar. It can throw these people into a manic episode. And finally, if you have liver or kidney issues, it's not that you can't use it, but you may need to adjust the dose slightly. So Modafinil is something I see have used a fair amount, but I would love to hear from you in the comments. Have you used it? Know somebody who has? Did you experience side effects? Just your overall experience would be helpful for me, helpful for other people watching the video. And speaking of which, I hope this video was helpful, and I'll see you in the next one. Thank you.